Hello, everyone, and welcome to the supply side. I'm your host, Tony Paquin, CEO of iRemedy. We are on a mission to demystify the intricate world of medical supplies, shedding light on all the complexities, the challenges, and the potential solutions within this important part of healthcare. Together with industry insiders, healthcare pros, good friends, partners, we'll dig deep and ask tough questions and maybe, just maybe, find some answers. Let's dive in today and explore what's happening on the supply side. But first, don't forget to press that subscribe button. Today, I'd like to introduce our good friend and partner, Dr. Marc Lederman. He's a renowned podiatrist, and he's read my recent book. He's got a great podiatry practice, been very active in healthcare, had a lot of experiences with medical supply. And we're just going to chat about his practice, his background, his history, and how his world is touched on the world of medical supply. Marc, welcome to the podcast. Good to see you.
Thank you, Tony. Appreciate it. Thanks for the invite.
So, love to have you here. Excited about chatting a little bit. Let's first, just give us a little background. Marc, first, you are in Connecticut, right? Where do you? Tell me a little bit. Tell everybody a little bit about where you live and what you do, and we'll kind of go from there.
I live in a small little town, Canton, Connecticut, with my wife. Our kids are grown and mostly out. My youngest is in his last year at University of Rochester studying chemical engineering, so we have little to discuss on that end because I don't understand much of what he does. I have a daughter out west in Colorado.
Other than that's a really good degree to get, so good for him.
So I have a daughter in Colorado who's in translational medicine. She writes and works on grants for companies like that we all work with in the operating room, Stryker and Wright Medical and others who need to take their products to the animal testing before they go to human testing. And she works at a place at Colorado State developing those tests and seeing them through. And my oldest son is a police officer here in Connecticut. So very varied group of kids. And
you've done well. You've done well. You've launched 3 good kids. You feel good about that.
3 good kids. Yeah, we paid attention. But I was born and raised in Connecticut and went to college at Drew University, a little small college in North Jersey, and then went to podiatry school in Philadelphia. Was the Pennsylvania College of Podiatric Medicine at the time. It's now part of Temple and has been for a few years. And I did my residency and my fellowship training down in Maryland, finishing up at the University of Maryland, actually in the Department of Orthopedics. That was a great year. And came back up and joined my dad, who was a podiatrist since 1960. And he just retired at the ripe old age of 89 from private practice.
Okay.
For some 62 years in private practice. Yep. And a great, well-known podiatrist in his own right for sure. And I have a partner, Dr. Rode, who I've worked with now for the past decade. And we've got a great practice, really perfect, varied, medical and surgical podiatric practice. It's a wonderful world.
Yeah, good for you. That's a great setup. So you've been in the same place for 20, 30 years then, too.
I have, yeah.
The same practice?
Same practice. We started in 1989. My dad and I, we moved to our current location about 20 years ago. We have one office and now we're part of a surgery center. I'm medical director at a surgery center, multi-specialty center about 10 minutes from our office. And that's been a really interesting venture. But as you know, it's best to run your own deal and be in charge because then generally things get done.
Yeah.
And so it's been.
Now, are they doing more than podiatry surgery, or are they doing?
Yeah. So multi-specialty. We have a lot of ophthalmology, GI, a lot of ear, nose, and throat, podiatry, some pain, injections, etc. So busy center. We do 6,500, 7,000 cases a year there total. So it's been fun.
Oh, no kidding. Yeah. Yeah, ophthalmology, I did the deal where they had, I had like a real light case of cataracts. Yeah, I have a great ophthalmologist, by the way, another guy that is an investor in the company, but he's really, really a good guy in Orlando. And he says, we can treat that and implant a lens. And
Right.
so my glasses that I wear are actually just reading glasses now. But I used to have a correction for distance, and they actually implant, like a lens to fix the cataracts,
Right.
and it corrects your vision. It's
Yeah.
pretty amazing surgery.
It's incredible. It's incredible how fast they do it. Some of the guys at our center work 2 rooms and will do 25 cases in a morning.
Oh, yeah, exactly. I was about to say it's like a 15-minute deal. And
Right.
the way he does one eye to make sure it all goes well. Then you come back in a couple of weeks, they do the other eye. Yeah, it was an amazing thing. And it's just a little weird having people operate on your eyes. I'm just telling you, it's kind of a strange deal because as I recall, you're sort of awake, or they do some deal where they're, desensitizing your eye and stuff. But that's a pretty amazing surgery. And yeah, I thought the same thing. It was like, he's like, boom, boom, boom. Okay, we're done. I mean, I thought he was just getting started. Yeah. So, but that's a great surgery.
And at our center, none of the podiatry, nobody wants to go in and see an eye done. Like, I'm curious, I would, but nobody wants to. Nobody wants to go near GI. The ENT is dealing with, noses and snot all day, and we've got too much blood going on. So nobody really interferes with any other specialty.
Well, to go see the eye, you're not really going to see anything. I think the guy's doing it all under a microscope, and
you just look at it on the screen. Right. Exactly.
Yeah, that's pretty amazing surgery. That was about, I think that was 7, 8 years ago, and like I've had no issues whatsoever.
Right.
I wish it could have corrected like bifocal, like correct my reading as well. And it was a little bit you had to choose. Like, he could either correct you to close up or correct you to distance.
Right.
And, I ended up going with the distance. And sometimes I wonder about that because, with my phone and everything, I always got to wear my reading glasses. And what some people do is they do one eye close and one eye distant. And then their brain sort of, like they say your brain, like with like contact lenses, people will do that. They'll wear one distance, one close, but I don't know. It wasn't for me.
I'll tell you something. So I bought a handful of years ago a pair of loupes to do microscopic surgery or close-up surgery with, right? Nerve surgery, such. But I have bifocals and I have progressive lenses. So when they made the loupes, the bottom is for close-up, and so it's perfect when I'm doing that. But then when I need to go ahead and suture, I can't see anything because they couldn't get the. So they have to take those glasses off, put these glasses on. So it's a little tricky when you have bifocals.
I hate to talk about the obvious. I do want to get into medical supplies a little bit, but the podiatry thing, especially as you get older, you realize foot health is like everything. It's really a big deal. And you wonder if people really appreciate that and understand that as much as they should, because it means a lot. And as I start to get older and I've got my mother-in-law and other people, and you realize, man, it's something they got to stay on top of. My mother-in-law is in a, I guess you'd call it a nursing home, assisted living.
Right.
We're really fortunate. She's an amazing story, by the way. She had a glioblastoma, brain cancer, 10 years ago. The life expectancy on that's only like 6 months.
Yeah.
And so she's a bit of a miracle case. Really amazing story. But at this assisted living facility, they have podiatrists who comes to the facility. It's really a great service, and they take care of the people, right there.
Right. Yeah, it is a good service. That's remarkable that she is still with you. That is very rare cases.
I'm telling you, I think she's like a world record. Like every time we tell somebody that, they're just amazed.
Right.
Typically it's like 6 months to a year.
Yeah.
And she is now, I think it will be 11 years in May that she was diagnosed.
Were they able to remove it?
Effectively, it's in remission. Now, she's got a little, a side effect of the treatment. She had chemo and radiation back, 10 years ago. But she's a remarkable individual. First off, she was a pastor. So she's real like faith-filled is the deal. And she's just motoring along. I don't know what else to say about it, but I talk to people about it all the time because we're in the business, right? Dealing with hospitals and doctors and everybody, and everybody's kind of close to the industry. And you tell them that story, and they're like, "Wow, I've never heard of anybody that has done that well." So it's pretty remarkable.
Right. Yeah, that's incredible. Yeah. I know nobody's such lucky.
So Mark, before we got going on the podcast, you and I were chatting a little bit about the pandemic in COVID. And it's interesting. I was on on a call earlier with one of my banking partners who's involved with some healthcare related industry activities, and of course, we're getting a little bit on the political side, if you want, because of my book and, things are happening in that area. We'll talk a little bit about that. But we were discussing how we kind of forget about the pandemic, this thing that happened. And it was like a black swan event. It was like a one-time, this is never going to happen kind of situation. And, I tell people, people my age, and I'm sure I'm older than you by a little bit anyhow, but we've seen a lot in our lives, but we never saw the complete shutdown of the entire world.
Right.
It's a pretty amazing situation. And in healthcare, you take like that surgery center of yours, they wouldn't have been doing surgeries, I would think, during that period. They probably pretty much closed down. Wasn't a lot of elective surgery taking place.
Correct. Although it's interesting from my perspective, we, at the time my dad was still practicing, and at his age, we followed the Yale University's guidance, and really anyone over 65, which I still consider kind of arbitrary, but they were told to kind of not see patients and go home. And so from whatever it was, like March 20th until June 15th, my dad didn't practice. And my partner and I, we had a ton of cases on that, like Thursday, whatever that was, March 19th or something, knowing that was going to be it. By the afternoon of March 20th, pretty much, as you said, the world had shut down. And what we did in our practice is, and we were in constant communication with our patient base through our email system and newsletters and such. And so we told patients, listen, unfortunately, infections, fractures, trauma, lots of things going to happen. We don't want you in the emergency rooms or the walk-in centers because that's where all the COVID patients are going. So we're open.
Yeah.
And we kept our office open 3 mornings a week, literally for 2 weeks. And driving home past packed grocery stores and liquor stores, I called my partner. I said, Kurt, what are we doing? Like, open in the afternoon, but not in the morning. I mean, so we kept it sane. We didn't overbook people, so the waiting room wasn't packed. But within 2 weeks after the start of COVID, before April really got going, we were open 4 days a week. My staff came in. The surgery center actually closed for about 8 to 10 weeks, except we kept one room open for emergency cases. And then after that, we were able to start doing elective cases back again. Ophthalmology and ENT, because of close-up work, were certainly a little more delayed than that. But for us, as long as the anesthesia felt comfortable, and they did, we went back to operating about 10 weeks after COVID started. So we'll get into some of certainly the supply issues and some of the things that came about because of it. But in terms of disruption of my professional life, almost none.
That's super interesting.
We didn't participate in COVID, is how I say
it. Yeah. Well, first off, we're in Florida. We always say Florida just skipped COVID altogether.
Totally.
But, it's kind of a weird deal. But we, in our businesses, you read the book, we know about Operation Warp Speed. But even aside from that, we never shut down at all. We were working right through it.
Right.
A little bit what you're talking about is interesting because the thing that I have always found in healthcare through 30 years of working with medical practices and hospitals and so forth, many, if not, I would say most, really by far, people really got into it at one point because it's sort of like mission. They really believe in what they're doing.
Mm-hmm.
And as to what you're saying, you're like, hey, we got to stay open. We got patients who, have a need, and we're here to meet that need. And
Right.
I think in some ways physicians are really sort of, they don't get the credit for that. I was actually watching the debate last night, and they're going at it, and they're talking about transparency of healthcare, and they're like, we need to know exactly what's going on with insurance companies, hospitals, and doctors' offices. And I'm like, yeah, I hear you, but there's not some big abuse in a doctor's office.
No.
The high cost of healthcare is not in the four walls of the doctor's office. I can tell you that,
not.
right?
Yeah, right.
And I'm not being political at all, but as a guy who knows the industry really well, we can have a long talk about regulatory issues and lawsuit issues and payer issues and hospitals. I mean, there's many things, but the doctor and the patient and a doctor's medical practice is not where we got a problem.
Exactly right.
Maybe some defensive medicine. Yeah. So
yeah.
I have a really good friend and partner, one of our investors, but a guy that we know really well. He has a massive OBGYN practice. I mean, huge. He's got about 10 physicians. They've delivered something like 5,000 or 6,000 babies. And his concern during COVID was, he said, he's like you. He said, we got to see people. People are pregnant. They got, we had to deal with it. But he said the risk for him was that the imaging centers were closed. And he
Right.
said, people weren't getting, regular screenings like they needed to. So he says, what we're going to get at the end is sort of undiagnosed, breast cancer, mammogram problems, stuff like that. That was their big concern. And, sure enough, they saw some of that when they, came back in. They had sort of that, a year's worth of screenings did not occur the way they should have. There just wasn't access. So
yeah, that's
really
so
interesting.
We saw that. We saw that in patients who, listen, peripheral artery disease continues on whether there's a pandemic or not, and we struggled to find someone to see these patients before they would lose a limb. And when we found the couple of people who stayed open and would see our patients, I shift my referrals when the pandemic, when we came out the other side of it. And that's who I started referring to. There were a number of practices, and listen, I understand the fear, but pediatrics and a lot of the primary care offices just didn't step up. They just didn't see their patients. And I don't know, maybe we were just dumb lucky that we didn't I never had COVID or never tested positive or whatever. But we were frontline to that degree and never backed off of it. And everything was fine. And these practices that 2 years later are still making people a call from the car. I mean, really?
It's really bizarre stuff. And we were like you. And, there was that whole experience that we had with Operation Warp Speed, but many other things. So we never shut down at all. And we were traveling. We had clients all really from California to New York.
Mm-hmm.
And it was really bizarre during that period. And, I had my full staff. And so we had, people out there meeting with clients, going into hospitals, doing all that kind of thing. And we had difficulties because, my staff would have children who were not in school because the school's closed or whatever. Although, again, in Florida, that was a pretty short period of time, frankly.
Right.
But still, it was very disruptive. And there was a time when we had to go to New York City to do some work from here in Florida. You couldn't fly. It was this whole weird situation going on. It was just easier. We rented a car. We drove all the way to New York City, which, by the way, driving through New York City during COVID was a bizarre experience. It was like a ghost town. It was,
right.
it was actually nice in some ways, but it was a fascinating period. And, but it did expose for us sort of the frailties of the supply chain.
Right.
And, so everybody was scrambling for this, I need masks, I need gloves, I need PPE and other things. And part of what we ended up figuring out was there wasn't always a shortage. Frequently there was, but what there really was a disconnect between the maker and the buyer, you know. Now, part of it was largely because of globalization, and the middlemen fell apart. So there's still the guy over there in China or Malaysia, Vietnam. He's still making the stuff,
right?
But he doesn't know how to connect with you and how to get it to you.
Right.
Plus, the ships weren't shipping and planes weren't flying, right? So there was this practical matter of you just couldn't get it from point A to point B.
Right? Although it was really a lot more than that. In reading your book, you talked all about the corruption and people that were completely fraudulent. You think you're dealing with actually a valid middleman, and it's actually not even a real person.
It's just bizarre. We talk about in the book some of the stories, but we had a day where we're finally getting going, and the story for people don't know, but basically the government came to us. They need needles and syringes for the vaccine. And then what happened is all the other suppliers fell apart. So these orders kept coming to us. In the end, it was like 1 billion items. And we're working on getting this going with manufacturers in China. And so we finally got shipping. And then one day, a guy shows up at our factory with like a Range Rover in China filled with gold bullion, right? And he's literally going to bribe the loading dock guy.
Right.
Which, when you think of that in the United States, like, you're going to show up at Ford Motor Company and bribe the loading dock guy to steal some Ford F-150s. Like, that's ridiculous. Like, that would never happen. But in China, it's the power structure is very different. So that loading dock guy is actually a very powerful person. So even the factory manager can't control him. And oh, by the way, his brother is the mayor who's a member of the Chinese Communist Party. Like, there's these other dynamics, right? Because when they tell us this, I'd be like, oh, you're kidding. Like, that's ridiculous. That's not, they're like, oh, no, that's like a real problem. And the thing is, it's kind of funny if they're making glasses, or they're making that American flag. That thing was probably made in China, by the way. But if they're making that stuff, you don't care. But if it's a medical product upon which our entire country is dependent, it suddenly takes on, this other meaning. And the other thing that we found is things that you don't really think about, right? So one was, I knew, of course, things were made in China, but I didn't realize everything was made in China, made in the medical supply chain. Now, yes, of course, it's not everything, but it's like 90%. It's almost everything.
Right.
So when you begin to think about that and you start kind of working through it, well, when something is made that you use, okay, a drug, a device, a needle, a syringe, whatever, it has to be made in an FDA supervised facility.
Even abroad.
That's right, wherever it is.
Right.
That's the theory. So in the United States, the FDA, they'll just drop in on you and they'll come take a look at what you're doing, right? Surprise inspection. Well, in China, there's no surprise inspections.
Right.
Like, you don't surprise that factory in China with some American FDA inspectors.
Right.
You just don't think of that, but that's the way it works.
Right.
It's all coordinated. And so we were talking to a factory and we're trying to expand orders. So we're going to a guy and the chairman of the factory, and we go, yeah, we need another, 10 million needles. And he goes, yeah, I can do those. And it was all about they would add lines, factory production lines. Mm-hmm. And he says, but I'm maxed out, but I have a sister factory that can make these, these items. And we're like, oh, okay, but do you have the certification? Does that sister factory have the certification from the FDA? Because we have to have that in order to manage the import, process. It's a little bit regular.
That's the 501k that you referred to in the book.
Right. That's right. And he goes, no, but I can loan him mine. It's like, oh, okay, that's something they can do. But in the United States, you wouldn't be able to do that. I couldn't take my certification and loan it to the guy down the street who's making, balloons, right? And so it's that thing that you just don't think about it. And we became really, really, really exposed to it on a grand scale was the deal.
Well,
The
and
thing,
for a private office, really for us, I mean, gloves, and we didn't need a lot of PPE equipment. I mean, I needed masks, and
yeah,
quite frankly, not that, I mean, we could wear a mask that we got online somewhere, and like I'm not sure
be
how much
okay.
that helped anyway, and
Yeah,
it really didn't matter. I mean, all the masks
yeah,
that people came in with were not, proper fit N95 masks anyway. So that's a
right,
whole other conversation. But,
right, exactly.
but for us, it was lidocaine with epinephrine, celestone steroid injections, um, getting the size needles we wanted to use so we didn't, we could hurt people less when we gave them an injection for how the technique is.
Mhm.
Um, ultrasound gel, because we do a lot of ultrasound, that kind of stuff. You
Those
realize,
are things you really have to have, and
yeah,
they're
you
very
have
particular.
cam boots and surgical shoes and things that we were used to. We don't inventory. You made a point about that in the book, but we don't have 6 months supply of everything we use. We have 3 of this and 3 of that in different sizes. And
Yeah,
quite frankly, I thought about it. For us, I think when we run low on something, I told Amber in my office that we're low, and I, for all I know, she called Kevin, who's our UPS guy, that I think makes it in his basement, because a day or two later he showed up with it.
yeah.
So that must be where it comes from.
When it's local. Yeah, the lidocaine thing is interesting. That's one of those ones that's constantly a problem. Yeah,
Right.
lidocaine is frequently in shortage, and
Why is that?
it's the exact same problem. Limited manufacturing overseas, and the way the system generally is designed is the whole complex supply chain, starting from the manufacturer through shipping to the distributor, down to local inventory to you,
Mm-hmm.
right? Is all based on like an allocation strategy. So the idea is Mark is going to need a case of lidocaine in July. So it needs to be made in China in November, whatever the case is, right? And so that's all worked out 12 months in advance.
Right.
And and so it's one of those, it works when it does, but as soon as you disrupt any stage of that,
Right.
and then as things happen around the world, those allocations get disrupted. It's kind of like, well, population growth. I mean, you just have more people, or there's a new type of surgery that's now using that thing that never used to use it before.
Right.
Or there's a war in Ukraine. There's like these global disruptions because you're in this globally dependent, problem. In some ways, it's a little bit like, I don't think the politicians do a good job of describing this, but when you think of global warming, and however you feel about that, right? Whatever your belief system is, it's a global problem, right? It's not an American problem
Right.
because the wind blows from here to there.
Right.
It's not, you can't isolate it down to it's Georgia has a
Right.
problem with global warming, right? It's the globe, right? And you can't isolate it. So if China is building a couple of coal factories every couple of weeks or a month, well, the reality is we're going to be impacted by it, right?
Correct.
Yeah, because it's a globalized environment. That's just the way it is.
Right.
Okay. So, okay, without going into the politics of global
Hard not to
stuff,
weigh into it.
yeah, but in the medical supply chain, it's the same thing.
Right.
So we're in a global supply chain, and we're impacted. Therefore, you got this problem in the war in the was it the Suez Canal or whatever that is, and
Right.
they're routing those cargo ships now down around Africa.
Right.
Well, that's mostly oil, I would assume, but it shows you sort of the problem that things way out of our control.
Right.
I mean, they had the Panama Canal about a year ago. A ship kind of got turned sideways or something, and it blocked the canal for like a
Right.
week or a month or whatever. And those your needles, your lidocaine was probably on one of those ships.
On one of those ships. So,
there's nothing you can do about it. So,
well, and in addition to the lack of supply is the cost. So, everything goes up. Rarely do things come down. Oil goes up and down. My diesel cost at my local, station will go up when they have to go around the Cape Horn. It'll go down when something else shifts. There's an election. All of a sudden it drops. But the cost of lidocaine goes up and stays up.
It never goes down. That's a weird thing when you look at these pricing discussions. There's always, we have a fuel surcharge, for example. But when the fuel price goes down, we don't get a readjustment of that. It never happens. Of
course not.
Right?
You're using it for something.
And it's just true that, when you look at the high cost of healthcare, the high cost of medical supply is the number 2 cost of healthcare beyond basically payroll. It's like if you're running a healthcare system, you have your human resource cost, your doctors, your nurses, all that staff. Then you have supplies, drugs, devices, scalpels, needles, syringes, all that stuff. And inflation is hitting those supplies, but way harder than it's hitting the cost of milk, to be honest.
Yeah, well, we feel
it's not 2%, 5%, it's 10%, 20% kind of thing. And the other thing that happens is you use your example, but it would apply to every doctor everywhere. It's whatever the cost is, you don't have any choice. You're gonna pay it. You need it. You need it. Right. You can't say, well, I'm just not going to use lidocaine this month. It's too expensive. That's not an option.
Not an option.
So, what's more costly is, first off, it's the health of the patient. And on a business level, it's, hey, we got to do that surgery tomorrow, or whatever the case is.
Yeah. And you can't recoup it because, in medicine, most of our costs, there are some procedures we do which are out of pocket. They're not covered by insurance. But most of what we do is covered by the patient's insurance. And there is no increase in reimbursement by any substantial measure year on year. But costs go up significantly. Labor costs go up and certainly supply costs go up. And it's very frustrating as a private practitioner to have supplies cost a lot and you can't even get them in a timely fashion. So
right. But to your point, I don't know that let people understand that, but what you're really saying is, your reimbursement is what we're always talking about, but it's basically fixed based on a negotiation with the payer, which is the insurance company, call it United Healthcare, whatever the case might be. They say to you, for that procedure, we will pay this.
Right.
And you could say to your team, hey, our costs went up 20%. Well, United Healthcare is going to go, well, whatever, that's not our problem. I mean, in essence, they would argue with me if they were on the phone right now. But basically, that's what takes place. Yeah,
that's exactly right.
So it's not what people think.
No, and as a matter of fact, I'll tell you, years ago, I was part of an ACO negotiation with one of the payers. I won't mention which one it was. And they said to us that there's 3 components to the system. One is patient access. So insurance companies are always very concerned about their subscribers being able to have access to physicians and specialists in their area. And the next was cost, because they're very concerned about the cost of healthcare because that's their bottom line. And the person I was speaking with got distracted on something else and went off. And I said, you said there were 3 things. I kid you not. She looked right at me and said, oh, yeah, patient care, but that's on you. I was like, but isn't that like number 1? They don't care.
Let's start with that. There's no question. I have a friend. I mentioned earlier. He's got this massive OB practice. Delivers a lot of babies. Great guy. Just wonderful, talented, wonderful, caring person. And his reimbursement for a baby is not it. It's based on he gets a flat dollar amount for the delivery of that baby. In other words, for the entire pregnancy. Right. So whether that pregnant mom comes in twice or 15 times, he's he doesn't get reimbursed for the visits.
Right.
He gets reimbursed for the pregnancy, and it's not very much. It's like
No.
$2,000 or something.
Right.
Everybody misunderstands that. They're like, "Oh my gosh, it's like $20,000." Oh no, he doesn't. And when you think of his costs, I mean, he probably sees that person, 6, 8 times, and they're calling, and they got this need and that need, which he cares about, and he's, again, a wonderful, caring physician. But it's a misunderstanding to think that every time you go see him, he's billing somebody $500. That's not happening.
No. And their medical malpractice rates are through the roof because it covers.
For those OBs, it's just terrible when they deliver babies. The exposure. Mm-hmm.
Right.
I'm pretty sure that he himself has stopped delivering. He now has physicians who work for him, but I'm pretty sure that he finally, quit delivering babies because of the exposure is just so high. The lawsuit.
So we're in an interesting time right now in medicine because not only is the cost of health insurance really high, but the newer doctors coming out are different. There's a little bit more me time built into the thought process. You and I are of the generation, show first, leave last, work through lunch, work hard. And you can have good, smart physicians that are coming out across specialties, but they're not going to be returning calls at 7:00 at night because I haven't left the office yet. And I want to make sure they know the result of that MRI. It's a really different world. And you add on what happened to patients and physicians' psyche during COVID, and this sort of newer generation of physicians, and the fact that so many are bought by other, bigger investment entities, so they don't even really work for themselves anymore. And I, you're an entrepreneur, so you know that there's a big difference between working for yourself and working for somebody else. It just is. And so we're at a really interesting crossroads. And then you add, so I know in your book, and I would love to get to it before the end of the podcast, hear your thoughts about what Washington needs to do yesterday to get us launched in the right direction. And things take money. And we printed so much money during the pandemic, that's got to come back to bite us at some point soon. And in addition to that, you're letting all these people in at the border, and we are better at providing care for people. It's put your own mask on before you put your child's mask on. We need to fix the issues we have, supply and medical issues, as we're talking about first, and then we'll be in a much better position to provide for all these people coming across, including
I totally agree with you. I completely agree. I think you and I are in an interesting place. It's funny because I sound so much more like my dad 30 years ago, but that's what happens. But when you think of generationally, like I have 3 kids, like you have 3 kids. My 3 kids are 26 to 33, right? So it's kind of that same
pretty much
sort of thing. And you just had your dad, I think of my dad. And we're in sort of this interesting middle generation. So I use the example of, I mentioned it in the book, because I kind of speak to this in the book a little bit. I just use it for illustration. But, my dad never took a day off work. He was born and was a child during the Depression. He was a certain era. Then he went through World War II, and then he just worked hard his whole life. And he was a wonderful guy. My dad was a good guy. Right. And hardworking, moral, ethical, taught us to do the right thing. He was a good man, right? Especially for his era. Yeah. And then we come along and we do our thing, and then there's our children. And you can see if you compare our children's generation to our father's generation, it's very, very different.
Right.
And what was great about America, this whole idea of American exceptionalism, and the thing is that it's a good thing. It's almost like today is painted as a bad thing.
Right, but it's not.
It was a good thing. Like, we saved the world there during World War II, but we were and we are the only, great moral leader of the world. But in order to do that, we have to be strong. And I don't mean militarily strong. And by the way, I'm an anti-war guy, so that's another conversation. We have to have strength. It's what you're talking about, in order to take care of our children or the next generation, we have to take care of our, what we have, right? And so I think, for example, on the manufacturing front, I think we could be making a whole lot more. We're never going to reverse globalization, right? We're not going to go that. I mean, maybe 50 years, but not in the near term. But we absolutely could be manufacturing here in the United States and in Mexico and Canada, for example, right? But there's money to be made. We can do it profitably. We can use automation, and even environmentally, when you think about it, right? Does it make sense to be running a freighter from Shanghai to LA?
Of course not.
Seriously? You can't make the stuff in Ohio, right? I mean, come on. Of course you can. So, I think that we have to do that, and we've got to get the spending thing under control.
Right.
And you just got to get some common sense has to begin to apply. If you continue to weaken our infrastructure, then things are going to happen and they're not going to be good. And the thing that gets me on this conversation is, in a way, COVID, and in my particular angle of the frailty of the supply chain based on the globalization in China, should have been like a Pearl Harbor moment. Right, where we said, "Oh my gosh," and we wake up and we do something about it, right? And that hasn't happened at all.
No, I know.
It's unfortunate that even the vaccination issue got so politicized, right? And I do believe the government made a mistake when they began to mandate the vaccine. I do think in many cases that was an error, right? Now, I could argue the other side is we make a mistake when we go to the other extreme and go, the vaccines are a horrible thing. And, hey, I got vaccinated, right? But I do believe that you shouldn't force it on people, right? But it became so political, we sort of have lost the importance. And it's a little bit of what you and I were doing when we were talking about it. At some point, we need to sit back and intellectually go and say, let's talk about what happened during COVID. Some people closed offices, other people didn't. How did healthcare work out? What about those imaging centers that were closed? How many more cancer cases did we get as a result of that? How do we protect against this in the future? Because what is true, we're going to have another COVID event. There will be another pandemic. It's a function of the growth of the global society, and there's just a lot more people. There's an extra billion people out there. We're going to have another pandemic, and it may be worse. It may not be as bad. It may be a lot worse, but it's going to happen. Are we smart enough to prepare? Right. And then the other thing that's happening is China is marching forward on a global strategy that is not in alignment with our best interests. They're just not. They believe in a different system. Their system is not based on personal freedom, for example, or individual rights. I tell people we can argue pro-life, we can argue pro-choice. In China, you can't even argue. Right? It is whatever they decide it's going to be. We can have the debate about which. So,
and you made the point in the book.
That's not going to.
No, I'm sorry. You made the point in the book.
No, go ahead.
So you made the point that in our support of China's manufacturing, we were misguided into thinking that the production of money will equal a capitalist society and communist will go away. And we didn't really read this properly. They just used the Communist Party to oversee the growth of capital, of an economy that produced more money. but it didn't produce a different political party. We missed it.
No, that was a great misstep over the
Right.
last 20 years. It
One.
was a mistake. We didn't understand that. But you wonder, like, do we know that now? I mean, it's like we know that it's a fact. It's a fact. Like it's not deniable. The Chinese Communist Party is not a moral freedom institution, right?
No.
And it has been funded by our dollars. But
Mm-hmm.
do we care? Is the interesting thing. So,
So,
and I think, we need to care.
yeah, but so if you look at, I think sometimes what appears to be nonsense news stories show you how large the problem is. For example, um, Cantor Freedom, right? The basketball star who played for the Celtics, I think, who was a Turkish born, I think, and comes here, becomes a US citizen. He was very outspoken about the NBA and China over their treatment of segments of people there. And I think the result
Right.
of that was that the Celtics had their games canceled because, that's how it works over there. And ultimately, he
That's how
doesn't play for
powerful
the
they
Celtics. And
are.
so that, but that's a serious issue because it shows you that while, again, it's hard not to get political on these things, but while certain influential members of the NBA are quick to denounce ills within our own society, the shirts that bears their names and a lot of money comes from China. And until you really are willing to recognize the problem, we have, as you said towards the end of the book, we still are the world superpower. While we still carry a little bit of influence, and we ought to have better conversations in this country, and it would still go to help our country and how we handle each other and some of the things that we still look to overcome socially in this country. But we need to stand tall here so that we can stand properly abroad. And I'll add this too, that just as an example, when we talk about manufacturing back here, and you made a great point about how made in America doesn't have to mean that everything is made in America, because there will be
Mhm.
allies and others we use as well. You want that. We'll never get away from globalization. We probably never should because it builds economies up of other countries. But
Right. Exactly.
Tim Scott talked about when he was working with Trump on opportunity zones to build businesses within inner cities. What a missed opportunity with all of the noise that is created politically in this country. We couldn't, and I really blame everybody, the media, the individuals trying to do it. Nobody was the adult in the room to say, listen, stop all the noise just for a second. We can pick a good manufacturing plant, plop it into one of the poorest areas of Baltimore, employ people, educate people, bring people out of welfare, make things in America like it works for everybody. And we couldn't get there because of the background noise. And if we don't cut the background noise, we're in a load of hurt. And what politicians get to put?
I think you're absolutely spot on with that, and that is just absolutely going to have to happen. I go back to, and you hear the noise about, not everybody needs a 4-year degree. That's true. We need to rebuild that manufacturing base, and really commit to it. It's interesting even for me when you talk about the politics, because if I were going to describe my politics, they'd be very complex. But I'm sort of in some ways right, some ways left, other ways middle. If you're really going to put a label on me, I was probably a little bit of a libertarian. I'm like a limited government guy, right? I think we have great government overreach all over the place, and the spending is completely out of control. And that's a huge problem. You're alluding to it. I think that's what creates inflation. But
Yep.
having said that, we do need government leadership on this problem. There are
Yeah.
just certain problems that we can't solve, completely in the private sector. This requires government leadership. When you get to what are we going to do? Well, first off, the largest healthcare provider in the United States, if not the world, is the
The
VA.
government. Right.
That's right. And then you got Medicare and Medicaid. So they're
Right.
the largest payer and the largest provider.
Right.
So there's that. Yeah, and they're probably going to continue to grow, right? So, but additionally, when you look at this, you know, the pharmaceutical industry, the medical device industry, you know, we're going to have to develop legislation to encourage, if not fund, the development of, you know, localized manufacturing. And we're going to have to rebalance this trade issue with China.
Yeah.
Okay. And we have to recognize the risk. And, you know, I talk about it in the book, and I write this little chapter that's the war game chapter
Oh,
about
that was
is Taiwan
scary, riveting, and frustrating all at the same time.
and I gotta tell you, like I know people in the kind of special forces community and the national defense community, and we all consulted on that. When you first look at it, it seems outlandish, but it's actually a very reasonable
Yeah.
thing, right?
Right.
And now, by the way, there's an election in Taiwan, and China's getting involved, and everybody's
Right.
got it's unbelievably too close for comfort kind
Yeah.
of thing. And so we have to recognize that there's a real national security, you know, aspect of this, and that's a government issue. You know, I
Right.
personally believe the number one responsibility of the federal government is national security that can come in many ways. It's not just about the Army, the Navy. You know, it's also economic and
Right.
diplomatic and you know other forms. And really, when you get down to healthcare, I don't think people realize you know how dependent we are on this you know foreign entity.
Well, and listen, the government played a large role in our going from, immediately post Sputnik to walking on the moon. And
Exactly.
but
That's
private
it.
industry did it, but the government backed those private companies that were producing at the rate that they were going to be the ones to get it done, whether it was Grumman or whatever. And in World War II, where we lacked in 1941 planes and tanks and ammo and so forth. It was plants like Ford and GM and others that, with
Mm-hmm.
government backing, turned things around. So we absolutely need the government. Listen, that's what they do. The government is supposed to protect us against foreign and domestic, adversaries.
Yes.
And
Yeah.
to me, this whole supply chain is both. It's a foreign adversary. I mean, we must get them involved. But if you look at something like, for example, 2008, Obama's president, the beginning of the push for solar energy. And so we don't put bids out there where any company that can reach this benchmark gets this grant. And then if you reach this benchmark, you get this grant until finally you're left with companies that are doing it right, financially and so forth. They gave $500 million to Solyndra. And where is Solyndra today?
Yeah.
That's not the way to do it. How come you and I recognize that and the government doesn't get on top of it?
Yeah, that's the sad situation about sort of the broken down nature of the political system today. And, boy, that's a big old fat problem to solve, but we really are split down the middle and we're paralyzed. Yeah, we have two parties, they won't agree, they won't get anything done. And then when something gets done, I mean, if you dig into that, you're going to see a fairly, I don't want to put the word corrupt. It depends on how you use that word, but certainly a favoritism, connected solution, insider. It's inside baseball. Let me just describe it like that. That's what it is, and those bets rarely work out. Why does America? Like what does make us great? When you look at it, Facebook, Microsoft, Google, Tesla, now you got OpenAI, and then you go back to my era, there are other companies, software companies that, were built up. Why, Ford, if you go back, General Motors, Pfizer, the list goes on and on and on. And it's really because we are great, inventors, entrepreneurs, creative, risk takers.
Right.
We have a great financial capital system that allows entrepreneurs to take risks. But that innovation is the thing that you've got to encourage and support and figure out a way to reward. Because what the point that you're making is there are probably a dozen solar innovators out there and entrepreneurs. They got pushed aside, and the one guy, because he had a little story to tell and he was connected, got the $500 million. That's what happened.
Right. That's what it
And
is.
that's what does not work.
Right.
Yeah, that doesn't work.
No.
We do great things in this country because we entrepreneurs take risks, we innovate, we get smart people, we get investors, we win some, we lose some. And, that's been our history here for 50, 60, 70 years. I mean, how far back you want to take it, really. But we're an economic powerhouse because of our innovation. What we've got to do is encourage that innovation into our manufacturing base in the healthcare industry somehow.
That's why I love companies like iRemedy. What you're doing is not just taking, some other model and trying to insert yourself into a little piece of the pie of what already exists. You're using artificial intelligence. You're using, I know, not that we have time to get into it, but taking an Amazon marketplace like model and working with people like Harding, et cetera, and building that for iRemedy so that it is different and better. That's what we need.
Yeah, the idea is to not pave the cart paths, right? Don't slightly improve the current system, but really completely disrupt and innovate. And, what the way to describe us is I'd say in the end, we're trying to do two things. One is we're trying to bring intelligence into the system. That's the AI, right? Using the power of AI. And, we got Jim Harding, former vice president at Amazon. He's a brilliant guy. We filed, 15 patents now all around this AI platform. It's hard. It's challenging. It takes a lot of capital. It's risky stuff. But step one is to try and get some intelligence around the supply chain. And step two is to try and disintermediate, if you will. And that is try and get a direct link between the buyer, whether it's a healthcare provider, a consumer, a government agency, and the supplier, who's typically a manufacturer, but sometimes is a hospital or somebody that wants to connect to a consumer. But the idea is to create these direct connections whenever possible. You can't do it all the time. You need Medline, McKesson, some of these legacy distributors, but whenever possible, connect up those direct connections. And we think by doing that, we ultimately can take 10 to 20% out of the cost basis. That's huge. That's really big. Hard to do, but it's, to your point, it's the kind of innovation you can't. A 1% improvement isn't really going to fix the problem. And really, we don't want to just sort of continue to rely upon this globalized system entirely. We've got to begin the process of coming up with a better way, right?
And your innovation is really, it's not so important for a small practice like mine. It's really the big surgery centers, the hospital systems. This is really where the impact is going to be felt financially.
Yeah, I think that we're trying to do is surgery centers for sure, hospitals, healthcare systems, payers. Ultimately, though, we do want to get it working at the practice level. The more direct you can get, it's not only is it lower cost, but it's also more reliable.
Well, that's true.
See, the interesting thing when you think about it is, under the current system, if you're even a hospital and there's a pandemic and all these bad things happen, and you go, "Where are my needles?" Well, the answer is you don't know. All you know is you don't have them. That's all you know, because you're not really in direct control of that supply chain. You're just counting on, a distributor to show up with the product. You've outsourced that entire activity to that distributor. That's not a good place to be. When Ford buys steel, they know exactly where that steel is coming from and where it is every step of the way.
Right.
When a hospital buys lidocaine, they have no idea really. They just know they're getting it from the local distributor.
Right.
And those two things need to, align more perfectly.
Yeah, I think that's going to.
And that's why I go back to, you would have thought during the pandemic everybody would have an aha moment, but we'll see how that works out.
Well, we're gonna.
So
I guess.
Mark, we're running up on our time. I always love chatting with you, though. It's great to see you. Appreciate you taking time with us, and
my pleasure.
In doing this, I know it's hard to get everybody's schedule working and to get the technology to cooperate with us. It's always a challenge, but again, I appreciate it very much.
Yeah, I appreciate it. I appreciate your company as well, and the things you and your brother are doing are really fantastic. And I'm gonna go on Amazon and make some pointed comments on your book. It was absolutely fantastic. I've actually I've got patients going out and buying it. I talk about it every day. It's really made a personal impact. A great job on it.
Thank you very much. I appreciate that. It was a challenge because we were trying to take this sort of dry subject and make it very interesting, and we thought we had a unique opportunity to do that because of the way the story was. It's a bit of a adventure story novel almost built into an educational piece on the supply chain at the same time. We have it now. We have the hardback, the paperback. There's now an ebook, and they're working on the Audible, the book on tape idea. So that'll be on Amazon as well sometime over the next 2 to 3 weeks. But
perfect.
We were the #1 seller in a couple of the healthcare categories. I mean, it's taken off. It's doing really well. So
that's it. Well,
we appreciate the comments. The more that, I appreciate that very much.
Thank you.
Well, again, everybody, thank you for joining us today on the supply side. I'm Tony Paquin. It's been a pleasure sharing insights and engaging in these critical discussions. We hope we leave everybody with some new ideas to ponder. Remember, positive change begins with understanding and dialogue. Make sure to join us on our next episode as we further explore the dynamics of the medical supply chain. Until then, stay safe, stay informed, and let's make a difference together. Don't forget to like, comment, and share this recording if you enjoyed the discussion. Thank you, and thank you again, Mark. I'll talk to you soon.
My pleasure. Thank you, Tony. Bye.